Joining me now is New York Republican Representative Nicole Malliotakis. Congresswoman, thank you for making some time for us today.
Thank you.
I know that you met with the Energy and Commerce Committee chairman today. The budget package is tasked with finding $880 billion in cuts. Do you have any idea at this point where exactly that money comes from? Do you get there without cutting Medicaid spending, for example?
Well, we're going to have another meeting with the chairman later today. I did have an opportunity to speak to him over the weekend, and it seems that they're looking for areas that within that space where it won't come from Medicaid beneficiaries, and that would make a big difference to me. Obviously, there's the waste, the fraud, the abuse, and the mismanagement of the program, but they're looking now at some of the energy space areas where, whether it's going to be deregulation or tax credits that are being offered under the IRA, or whether it be certain electric vehicle mandates. I think that they're looking to try to shave off some of the savings there so we don't have the problem that many of us were concerned about regarding unintended consequences to Medicaid recipients. And so I'm still waiting for more clarification and more assurances before we move forward. But at least I feel that they're listening to those of us who have large Medicaid populations, and we want to make sure that our constituents, like I said, are not going to suffer unintended consequences. So that's the first piece of this, yes.
When you talk about waste, fraud, and abuse, particularly in the Medicare, Medicaid system, do you think that is a big enough of a chunk to make a real difference here? Do you have any idea of how much money that might save tackling those particular issues?
Yeah, look, I think it could be a very large amount. I mean, if you look at New York State alone, there's a regular occurrence where we're reading about some type of fraud in the system. And I think it goes beyond just individuals who are not eligible or individuals who are fraudulently taking money from the program. I think it actually goes into some of the state policies where they're taking advantage of loopholes to get more Medicaid funding from the federal government that they're not entitled to. So, for example, New York State has implemented a tax on medical facilities, and they implemented that tax to get double the amount from the federal system, and then they go and reimburse those facilities. That is a scheme. That is not something, I would call that more of an abuse in the system. That's a loophole that I believe should be closed. I think what my main purpose here in pushing back on this resolution at the moment is making sure that our hospitals, the organizations that serve the developmentally disabled, the senior citizens I represent who rely on Medicaid for nursing home care, that they're not going to be affected, that we're truly going to go after the inefficiencies in the program and, implementing work requirements for able-bodied without dependents, that's okay. Making sure that only citizens are qualifying for this program, that's okay. But I don't want to go into some of the other provisions that might lower reimbursement for my hospitals or affect the end users.
I do want to ask you, though, and we'll put up some numbers here that our political unit crunched for the benefit of our viewers. More than 23% of adults under 65 in your district rely on Medicaid or some other means-tested public health care as their sole coverage. Could you see yourself voting for any package that does contain some sort of cuts to Medicaid?
Well, like I said, the goal here is to not cut from the end user. What we want to do in some of these cases, you would see perhaps work requirements if they're 18 to 64 years old and they're able-bodied, they do not have dependents, ensuring that they are working to receive benefits. That's one thing that we've talked about often. I think there's a consensus, an agreed-upon consensus on that. I think the other issue that we have with the states is that with the expansion population, the federal government is picking up 90% of the share, and the state is only kicking in 10%. And so maybe there's an opportunity to require the states to invest more in their Medicaid expansion so the burden is not placed on the federal government where we're facing a $37 trillion debt. And we know that this is one of the biggest areas where we are spending money. And I think at the end of the day, if we make this program more efficient and better managed by rooting out the waste, fraud, and abuse and the mismanagement of the program, there will actually be more money for its intended purpose, for the end user, the person who's the vulnerable senior citizen or a person with disabilities in my district or someone who is can't afford the health care program is not eligible. And so those are the things that we're trying to grapple with. Look, at the end of the day, this is about making sure we don't have unintended consequences. Just last week, we saw how the firing across the board, firing at CDC, led to 16 World Trade Center healthcare program workers, people who are treating 9/11 victims and first responders, and grants that go to 9/11 illnesses. That was being cut. They threw out the baby with the bathwater. We had to go and then work with the White House to get that reversed and those individuals reinstated and the grants reinstated. That's what I'm trying to avoid here, right? To make sure that we're doing this with a scalpel and not a sledgehammer.
Well, let me ask you a little bit more about that. As we've been looking at the Trump administration push to cut the size and scope of government over the last month, you did post last week when looking for savings to reduce our nation's $37 trillion debt, we need to use a scalpel, as you just said, not a sledgehammer, to avoid unintended consequences and unnecessary anxiety. Now, we've seen the government scramble to rehire those fired workers you mentioned. Elon Musk posed with a literal chainsaw last week. Is the level of cuts right now as targeted as you would like to see them? Is this the way to effectively get to the end result?
Look, I think they need to be more targeted and they need to be more thoughtful. I think, President Trump has appointed some really wonderful people to lead his agencies, and these secretaries of the various departments should be looking at the agency, seeing where efficiencies can be made, seeing where there's too much overhead. Unfortunately, operating budgets are huge, and we're spending money on overhead and operating and not necessarily the actual benefits that we want for the American people. And we have seen, like I said, with this 9/11 health care fund, a reversal and a correction, but it should never have gotten to that point. So things are happening a little bit too fast and furiously, I think, and that's why we've had some of these unintended consequences. We also saw the National Park Service, some seasonal hires, that being reversed as well to reinstate those individuals. So instead of doing this in a very broad way and then having to retroactively, reverse your decision, why don't we take a little time, do it more thoughtfully and thoroughly, making sure we're actually addressing the waste and mismanagement and the unnecessary overhead, as opposed to making these rash decisions and then having to backtrack.
To that end, I can't help but to notice the news today. Over the weekend, we saw this email that was sent to federal workers asking them to reply with the 5 things, their 5 accomplishments from last week. There's some agencies that want their employees to respond. Others are urging them not to respond or to wait to respond, to wait for more guidance. In your view, is this the right way to run a government? Is this an effective way to get your workers to produce results?
Well, again, I think this needs to be done from the immediate management level. We have secretaries that have been appointed, and those secretaries should be asking those who report to them to maybe it is smart to do a weekly report on what are the achievements of the employees. I mean, when I worked in the private sector, we did that, and many of my employees tell me at the end of the week what legislative successes that they were able to achieve for the constituents. And so I think that it's okay to ask for, sort of like a weekly report on what you've been able to accomplish that week on behalf of the taxpayers. I just think it needs to be done in an appropriate manner, and it should be done by the management within that particular department.
All right, Congresswoman Nicole Malliotakis of New York, we appreciate your time today. Thank you.
Thank you.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.